At 11, autism diagnosis rates in children have tripled in the past 16 years. That's according to a new study published in the journal Pediatrics.
So just why are we seeing higher rates of autism? Our Marissa Thomas spoke with local autism organizations to find out more. Marissa, how are these nonprofits impacted by the number of people who are diagnosed with autism?
Good evening, Mike and Emily. According to the CDC, 1 in 44 individuals are identified with autism spectrum disorder. The nonprofits I spoke with tonight said there's never enough staff and resources available to meet all the needs of the community.
As autism rates have gone up throughout the years, one might question why. A big reason behind the increase might be growing awareness.
Working with our pediatricians, schools, and providers becoming more aware, people are starting to see those signs of autism earlier. And so we are ultimately getting more diagnoses, even if maybe the frequency of autism isn't occurring more readily in the population. We're just more aware of it.
With increased awareness of autism, the process of diagnosing ASD for doctors has improved.
So we're doing a lot better at diagnosing, identifying individuals at a younger age during their toddler years. There are signs now pediatricians have that when they're doing their well baby checks, where they can go through and be able to identify early on if an individual needs further evaluation.
And getting an early diagnosis can make all the difference.
This early intervention is such a key component to better outcomes for individuals that are identified as living with autism.
With the number of people living with ASD, the resources available aren't meeting the needs of the community.
So it is a never-ending stream of phone calls, and I know that doesn't just go for Kaleidoscope, that goes for all providers in the area. We simply can't keep up. There's just so much need and not enough staff to go around.
The Autism Society told me by the end of 2023, they'll have launched 8 new programs for those in the community that are identified with ASD. Marissa Thomas, Erie News Now.